You know that feeling, right? That frustrating lightning bolt pain that shoots down your leg? Every single time you go to stand up, you're wondering, is this the step that's going to set it off? Well, today, we're going to get crystal clear on when trigger point injections are a really smart move for that sciatica-like pain and when they might be missing the target completely. This really just hits home, doesn't it? It's that constant uncertainty, that feeling of always negotiating with your own body. So, in the next few minutes, we're going to replace that uncertainty with a clear framework so you can finally get some answers. Okay, let's dive right into this because honestly, this is the whole ballgame. It is totally possible to get a technically perfect procedure that was never, ever going to work because it was aimed at a symptom, not the actual source of the problem. We're going to figure out how you can tell the difference. So here's the thing you've got to remember. Sciatica is just a nickname. It's not a real diagnosis. It's kind of like saying you have a stomach ache. It tells us where it hurts, sure, but it tells us absolutely nothing about why. And that's exactly why a one-size-fits-all sciatica shot so often just doesn't work. All right, so this brings us to our first and probably the most important question we need to ask. Is this pain coming from a nerve or is it coming from a muscle? What's so interesting here is just how different these two things are when you look at them side by side. On the left, you've got nerve root pain. Think of this like a faulty electrical wire, a live wire. It's sharp, it feels electric, and it often brings along some friends, like numbness, tingling, or weakness. But on the right, you have referred muscle pain. This is a totally different beast. It feels more like a deep, radiating ache. And the number one clue, you can often find a sore spot that when you push on it, sends that familiar ache right down your leg. And this right here is a super simple but really powerful rule of thumb. Now, it's not 100% foolproof, but pain that consistently travels down below the knee, especially if it comes with numbness or tingling in your foot, that really raises the odds that a nerve root up near your spine is the real culprit. You see, muscle referral can travel pretty far, but nerves love to send those signals all the way to the end of the line. So with that in mind, let's do a quick little mental fit check. Okay, you should consider saying yes to trigger point therapy if you can find a spot, maybe in your glute or your hip, that reproduces your exact pain when you press it. Also a yes if your symptoms are mostly just an ache or a tightness. But, and this is a big but, if you're experiencing clear numbness or your leg just feels weaker week after week, that's a signal to hit pause and ask about a nerve-focused evaluation. Now, here's where things get a little more complex. The reason this can be so tricky to diagnose is that there are several different conditions that can all put on a sciatica costume. Just take a look at this lineup. You've got your classic disc herniation, which is literally pressing on a nerve. Then there's spinal stenosis, where the canal in your spine gets narrow, and that usually causes pain when you stand or walk for a while. You've also got the SI joint, where your spine meets your pelvis. That can send pain right into your buttock. And believe it or not, even a problem with your hip joint can pretend to be sciatica. The key takeaway, each of these requires a totally different game plan. And this story about Jen, wow, it is a perfect example of that right needle, wrong address problem we talked about. The tenderness in her buttock was real, for sure. It was a loud symptom, but it was just a bystander that was reacting to the real problem, which was an irritated nerve root higher up. That little bit of brief relief she got, that wasn't a sign to just do the same thing again. It was a clue that they needed to look elsewhere. Okay, so what can you actually do with all this information? Let's get to the most actionable part of this. I'm going to give you the tools you can use to change the conversation with your doctor and get to that root cause a whole lot faster. This is it, right here. This is the one question that can dramatically, completely shift the plan. If a clinician can press on a spot, say, deep in your glute muscle, and you go, yep, that's it, that's my pain, well then a muscle-focused treatment, like a trigger point injection, suddenly makes a lot more sense. But if not, the investigation needs to start looking elsewhere. All right, let's turn this into a super practical tool. I call this your signal calculator. Just take a second and answer these 3 simple questions for yourself. They're designed to help you collect the specific kind of information that really matters when it comes to getting an accurate diagnosis. And here is your action plan. It's simple. If you answered yes to 2 or more of those questions, that's a really strong signal that you need to have a very specific conversation with your doctor. It's time to ask directly, hey, could this be coming from a nerve root, and what's our plan to confirm that? So where do we go from here? What is the one concrete step you can take starting today to bring absolute clarity to your next appointment? It's really simple, but it is incredibly powerful. I want you to create a simple one-page log for the next 7 days. Just track these 6 things. And listen, this isn't just about collecting data, it's about telling a story. It's a story that shows your clinician not just that you have pain, but how that pain behaves. It replaces these vague descriptions with concrete patterns, and patterns are the absolute key to a good diagnosis. And that log, it leads you right here to this question. This is the one question to bring with you to your appointment. Think of it as your polite superpower. It respectfully asks for a specific plan, not just another procedure. It makes sure that you and your doctor are working together to target the true source of the problem, so you can finally find that step that lets you exhale.